This part of the series is talking about HIV and AIDS, and I'm here today at the residence, the home of Miss Gertrude Armstrong and her son, Mr. Wesley Banks, that resides in Fayetteville, North Carolina. How you doing? And thanks for letting me come to your home today.
Thank you.
How you doing, Brother Banks? Miss Armstrong is a strong person in the community, and she's one of the true people in the community that has fought very hard for her son. Even, I used to think that Mr. Banks had no home, Miss Gertrude, years ago, I'm telling you. He's out on the street corner, and he always a good person, but I thought he had no home, thought he had no family until I met you not too long ago.
Right.
And I thought that was very good that, Banks, that you had a mother like Miss Armstrong that was truly loved you, because many people live with HIV and AIDS that have, that are mentally challenged or have some problems due to the fact of drugs in the past, really don't have no one to take them in, and just thank God for that. Miss Armstrong, just tell us, you know, you so many times said that you wanted to have a house that help people out living with HIV and AIDS, and we still have a problem with that today, and in particular when people have a mentally challenged or they really have other problems and people don't want to deal with it, dual problems also. Could you just talk about that?
Yes, and I'm glad you mentioned that because Wesley has always had a home, but his choice was to live out the street, and as a young man, that was his choice. But his family has always been here. We've always loved him. Wesley has a triple diagnosis. And when he got very ill last year, it's been a year right now, he was living in a rooming boarding house in one room, and he got very ill, and then he acted.
And even living in that boarding house, you know, I do street outreach on the street corners late at night and weekends. He probably wasn't even, most of the time he wasn't even there, you know.
That's true, and he wasn't getting any care. In fact, his T-cell count was down to 50, and the nurse practitioner at Duke, UNC, would not even put him on medication unless he had someone who would be able to help him with the medicine, because he couldn't start it and then just stop it, and it had to be consistent. So I again said to him, Wesley, you always have a home, and he agreed to come home that time, and he did, and they put him on the medication. The medication is wonderful. But I also know in this year that we have been together, the medication is secondary. The home environment, having someone who loves him, and a family, someone who wants to take care of him, someone who has the compassion. We've gone through a lot in this year, but only through the grace of God have we come through to where Wesley is now. Wesley is, his viral load is negligible.
That means you can't identify it.
Right.
Viral load is so low.
Yes.
Yeah.
And he has come such a long way, mentally, physically. Yeah, it's, that's it.
Right now it's less than 200. I'm doing good,
Your viral load.
Yeah, just got to get my CD4 count right.
Yeah.
That's about the only thing left now.
Yeah.
As long as I keep taking the medication, up where I need it to be.
But you know what? You know, even that both of you, one thing that really concerns a lot of us is that even though, like you said, the individuals at Duke Hospital said that they could not give them medicine unless they had someone to monitor it. You know, just think about all the other people out here that are dying much earlier in life if they had medical accessibility because of the dual problems that they have.
Yes, Wesley, that's one thing I found out. I would say to him at first when he first came, I would say, okay, Wesley, make sure you take your medicine at a certain time. And so I'm presuming he was taking it. I'd find pills under his pillow. So I understood then to know it had to be a monitoring. Even now sometimes I have to check, or if I don't, now this morning he reminded me because I hadn't refilled it. These are things that we just take for granted they're going to do. But no, if they have other issues, and he's lived on the street so long, that mentality.
But then you have to go to work.
Yeah.
And you see, that's a problem also economically. You have to go to work, you have to live, you have to pay your bills, and then you as a mom have to make sure that he is taken care of properly. You see, we have a major problem. Just think about other families in the community that really have to work and really are not as educated as you are as far as making sure, knowing the important significance of taking the medicine on time. I think that is something that's...
Those things we take for granted because we do them. There's some things that the way we're raised, we just take for granted everybody does it that way. Everybody knows. Just like, you take for granted everybody knows Jesus. Everybody knows he saved the world. We realize, no, some people don't even have that foundation. I mean, just the fact that people get up and brush their teeth, that they have 3 meals a day, we take it for granted because that's the way we were raised. And then you get out there and find out some people don't know that. They have to be taught. And Wesley had lived and been taught that, but Wesley had been in the street long enough that he resorted to survival, which is what most of them do. They have to survive.
But AIDS is the leading cause of death for African Americans from the ages of 25 to 44. Even more senior citizen African Americans are becoming infected now. We're having many more problems with sexually transmitted diseases, the syphilis epidemic, and this disease is spread more. Even those people who are HIV infected now or have AIDS now, there's got to be more care for them also. And the system really is not set up now to take care of all these other problems, because not only when you have AIDS as an African American, many times if you're poor, if you're uneducated, or if you don't have a family support, then many of them with these dual problems or that are mentally challenged, they go right back on the street corner, not aware of what the severity of their problem, and they spread this virus, not intentionally. You see, and we still have a major problem in our healthcare system. What would you were thinking about starting housing? Because you've had some problems with the healthcare system. What are some of those problems?
Just in the fact that, I mean, for one thing, if you're not involved, you don't really know what questions to ask. You don't know what to expect. So then you have people telling you, this is what we do. This is what we're going to do. He was in a day program. And all the things they were telling us, we're going to have activities for them. We're going to have their meals. We're going to make sure that they get to their appointments. We're going to schedule appointments, all the things that have been, and that I couldn't do because I had to work. And then to find out, one example that still, it makes you want to cry, is that they would be taken to UNC, 2-hour drive. He'd get home at 7 o'clock at night. They would take him there to go to the clinic for their treatment and to have their tests. And I found out the reason he was debilitated, no strength, to spend all day. And then it didn't matter if no one took care of his lunch and stuff. They were there all day with no food, tired. To find out that they went there where they could have gone to Fayette. They could have gone to Robinson County, so much closer, but because Medicaid pays for you to go there. And you get money.
Just a rip-off. It's not about the patient, it's about making the big bucks, making not the care of the... And so many other people have that concern.
Yeah, he vegetated. This is a young man that loved to play chess. And we talked to the so-called case manager and said, oh, we'll get a chess program on the computer, and he can do that, I mean, to be entertained. And I thought he'd be walking the street all day. I'm thinking he's in this program, and there's activities.
And they're getting paid for that.
Getting paid.
Because they're charging through Medicaid that they're taking care of providing these services.
And none of it was done.
There's no monitoring system to make sure accountability.
Because there was a problem emotionally and mentally. You didn't take much credence in what they'd say. He'd say, well, I didn't do anything, and I'd be thinking, well, no, it can't be. I know.
But just think if you were a mom that was not intelligent enough to understand and an empowered person, how he would have drifted by the wayside through bureaucracy.
Continually, and the family also.
Wesley, how do you feel today with mom so caring and loving, and I tell you, you have improved tremendously. You're like a new person today.
Yeah, I am a new person today, and I thank the good God for that, for bringing me through this far.
You thank the good Lord for bringing you this far?
I have to, because He brought me a long way. I mean, because I can admit that I was out there. Really didn't want to be out there, but I guess I just chose to be out there.
You feel a lot better today.
Oh yeah, because I don't have to be under no bridge, sleeping under a bridge, or I can be in here as comfortable, baby, even though I can feel the spring.
He said he can feel the spring, don't have to be up on the bridge anymore. You can feel the comfort of spring.
And Lord, I'll take this Xanamine that night, because without the Xanamine, I can't sleep. I don't know why, I just can't sleep.
But you take the medicine, and you're eating, very good.
Well, I never had so much healthy food in my life.
So when you start this house, we have to go short. When you start this house, you know, I've talked to you, and you're planning now that God led you to do more missionary work and
Yes.
and to start housing for people with HIV and AIDS and more family atmosphere instead of bureaucratic
Yes.
institution atmosphere. I think that's great, and you're trying to start this very soon.
I do, yes, because I see that what more than anything that has helped him is the love and compassion of the family. And it has to be based on the love that God showed, the compassion he showed, and not the dollar signs, not what I can get. Because God takes care of his own anyhow.
Right.
And this young man, I mean, there's a leper in the Bible, Naaman. He was a captain of the guard. This man was a leper in a time when lepers were shunned. Again, still, because he has AIDS, and that's like a modern day leprosy, doesn't mean he doesn't have ability.
Right.
And that there is not a gift that God has placed in every one of us. And that should be brought out. They are a contribution to society. But society has made them to think they're pariahs, that they're not. And so, but with love. Because he's wonderful. And he knows he's wonderful. He knows he's wonderful because he has someone who looks at him as a gift. And that he has potential. But there are others who don't have, they just don't. So they don't think that of themselves. Because no one
And
thinks
so that's why it's important to start this housing.
Yes.
Before we end, I would just like to show you some of the medicines that Wesley takes on a regular, daily basis, you know. And this medicine is very, very costly. And then many times, even though Medicaid might pay for some or Medicare pays for some, I tell you, there are a lot of people living with HIV and AIDS. There are other medicines that sometimes Medicaid won't cover and that you have to pay for. So it's very important that, you know, we find a way to give people better care that's living with HIV and AIDS so they can live a longer and healthier life.
Yes.
Thank you so much. Appreciate it so much.
You are so welcome. I
Thank you.
appreciate it. God
Thank
bless
you.
you.
Thank you so much, Wes. And you take care. You hang in there, okay? Take care now. You're looking great, brother.
Thank you.
Thanks a lot.
Oh, you're welcome.